How do you know if you have contracted hepatitis C?
Hepatitis C is a viral liver infection caused by the hepatitis C virus, HCV. It is often called the silent killer because many people live with it for years without noticing symptoms, while the virus continues to slowly damage the liver. Globally, it is estimated that around 50 to 70 million people are living with hepatitis C. Every year, millions of new cases are diagnosed. The infection is particularly common in people who inject drugs and share needles, but it can affect anyone. In many developing countries, unsafe blood transfusions and poorly sterilized medical equipment contribute to widespread transmission. How does hepatitis C spread? The main way hepatitis C spreads is through blood-to-blood contact. Some of the most common transmission routes include 1. Sharing needles and syringes. This is the most common cause worldwide. 2. Unsafe medical procedures, using unsterilized surgical or dental instruments. 3. Blood transfusions, especially in places where blood is not tested properly. 4. Mother-to-child transmission. The virus can pass during pregnancy or childbirth. 5. Sexual transmission. The risk is lower compared to hepatitis B, but it is still possible, especially with unprotected sex or multiple partners. 6. Household risks, sharing razors, nail clippers, or toothbrushes that may have traces of blood. It's important to note that hepatitis C does not spread through hugging, kissing, sharing food, or casual contact. Symptoms of hepatitis C. Most people do not notice any symptoms for years. However, when they appear, they may include fatigue and weakness, loss of appetite, nausea or vomiting, pain in the upper right side of the abdomen, yellowing of the skin and eyes, jaundice, dark-colored urine and pale stools, in advanced cases, swelling of the abdomen and legs. Because symptoms are often silent or mild, many people only discover they have hepatitis C during routine blood tests. What happens if hepatitis C is left untreated? The virus causes progressive scarring in the liver, known as fibrosis. Over time, this can develop into cirrhosis, where the liver tissue becomes permanently damaged and can no longer function properly. Cirrhosis increases the risk of liver failure and liver cancer. According to studies, about 20 to 30% of people with hepatitis C eventually develop cirrhosis. Among those with cirrhosis, 1 to 4% each year go on to develop liver cancer. Hepatitis C can only be confirmed through medical testing, since many people do not feel sick until serious liver damage has already happened. The first step is a blood test that looks for antibodies against the virus. If antibodies are present, doctors then check how much of the virus is in the blood, known as the viral load. In some cases, liver scans like ultrasound or elastography are performed to see if there is scarring or stiffness in the liver. These tests show how advanced the disease is and help guide treatment. In the past, treatment for hepatitis C was very difficult. Older medicines such as interferon and ribavirin had to be injected, caused many unpleasant side effects, and cured less than half of patients. Many people avoided treatment because of this. But in recent years, medical science has completely changed the outcome. Today, the standard therapy is a group of pills called direct-acting antivirals, DAAs. These medicines target the virus directly, stopping it from multiplying and clearing it from the body. Treatment usually lasts between 8 and 12 weeks, and the cure rate is over 95%. The side effects are usually mild and temporary, such as headache or tiredness, making them much easier to tolerate compared to the old injections. Some of the most widely used DAAs include sofosbuvir, ledipasvir, and velpatasvir. With these drugs, hepatitis C is now considered a curable disease. In conclusion, hepatitis C is no longer the hopeless condition it used to be. With modern treatments, most patients can be fully cured in a matter of months. The biggest challenge today is not the lack of medicine, but the lack of awareness. Millions of people are still undiagnosed, living with the virus without knowing it. By getting tested, protecting yourself from risky behaviors, and seeking medical care, this silent killer can be defeated. Knowledge and prevention remain the strongest tools to save lives and stop the spread of hepatitis C worldwide.